Welcome to my channel Health for You. What is eclampsia, pre-eclampsia versus eclampsia? Eclampsia is a condition that only occurs during pregnancy and causes seizures, usually late in the pregnancy. It is a rare condition, affecting 1 in every 2000 to 3000 pregnancies every year. The condition follows a high blood pressure disorder called pre-eclampsia. In pre-eclampsia, high blood pressure levels in the mother reduce the supply of blood to the fetus. This can mean that the fetus does not receive as much oxygen and nutrients as it should. Many of the pregnancies affected by eclampsia or pre-eclampsia are first pregnancies. Around 70% of cases in the United States are in first-time pregnancies, while eclampsia can be fatal if untreated. It is very rare for pregnant women to die from the condition in developed countries. Globally, eclampsia accounts for approximately 14% of maternal deaths. In the majority of cases, pre-eclampsia symptoms are mild and do not require any intervention other than monitoring and possibly diet change. Pre-eclampsia versus eclampsia. Eclampsia is the final stage of pre-eclampsia and requires immediate medical attention. Most cases are detected early in the pregnancy before they can progress to eclampsia. While there is no cure for preeclampsia, doctors will often prescribe medications to lower blood pressure or anticonvulsant medications to prevent seizures. With both preeclampsia and eclampsia, the only cure is for the affected mother to give birth. Mild cases of preeclampsia can be monitored throughout pregnancy to determine whether or not it is safe to let the pregnancy go to term. More severe cases might require immediate intervention, often in the form of induction or cesarean delivery. Most commonly, a cesarean delivery will be required to prevent the rise in blood pressure that is often seen during childbirth. What are the symptoms of eclampsia? Because pre-eclampsia can lead to eclampsia, you may have symptoms of both conditions. However, some of your symptoms may be due to other conditions such as kidney disease or diabetes. It's important to tell your doctor about any conditions you have so they may rule out other possible causes. The following are common symptoms of pre-eclampsia: swelling in your face or hands, headaches, excessive weight gain, nausea and vomiting, vision problems, difficulty urinating. The following are common symptoms of eclampsia: seizures, loss of consciousness, agitation, headaches or muscle pain, upper right abdominal pain. What are the causes of eclampsia? Eclampsia often follows preeclampsia, which is characterized by high blood pressure after the 20th week of pregnancy and protein in the urine. If your preeclampsia worsens and affects your brain, causing seizures, you have developed eclampsia. Doctors don't know what causes preeclampsia, but they can explain how the symptoms of preeclampsia can lead to eclampsia. High blood pressure. Preeclampsia is when your blood pressure or the force of blood against the walls of your arteries becomes high enough to damage your arteries and other blood vessels. Damage to your arteries may restrict blood flow. It can produce swelling in the blood vessels in your brain and to your growing baby. If this swelling interferes with your baby's brain's ability to function, seizures may occur. Proteinuria. Preeclampsia commonly affects kidney function. Protein in your urine, also known as proteinuria, is a key sign of the condition. Each time you have a doctor's appointment, your urine will be tested for protein. Typically, your kidneys filter waste from your blood and create urine from these wastes. However, the kidneys try to retain nutrients in the blood, such as protein, for redistribution to your body. If the kidneys filters, called glomeruli, are damaged, protein can leak through them and it excrete into your urine. What are the risk factors of eclampsia? If you have or have had severe preeclampsia, you may be at risk of eclampsia. Other risk factors are seizures during pregnancy include hypertension, high blood pressure, headaches, being older than 35 years or younger than 20 years, pregnancy with twins, first time pregnancy, history of poor diet or malnutrition, diabetes, or another condition that affects your blood vessels. Eclampsia and your baby. Preeclampsia and eclampsia affect the placenta, which is the organ that delivers oxygen, blood, and nutrients from the mother's blood to the fetus. When high blood pressure reduces blood flow in the heart and vessels, the placenta may be unable to function properly. This may result in your baby being born with a low birth weight or other health problems. Problems with the placenta often require preterm delivery for the health and safety of the baby. In rare cases, these conditions cause stillbirth. How is eclampsia diagnosed? If you already have a preeclampsia diagnosis or have a history of it, your doctor will order tests to determine if your preeclampsia has happened again or gotten worse. If you don't have preeclampsia, your doctor will order tests for preeclampsia as well as others to determine why you are having seizures. These tests can include blood tests. Your doctor may order several types of blood tests to assess your condition. These tests include a hematocrit, which measures how many red blood cells you have in your blood, and a platelet count to see how well your blood is clotting. Blood tests will also help examine your kidney and liver function. Keratin test. Keratin is a waste product created by the muscles. Your kidneys should filter most of the keratin from your blood, but if the glomeruli get damaged, excess creatine will remain in the blood. Having too much creatine in your blood may indicate preeclampsia, but it doesn't always. Urine test. Your doctor may order urine test to check for the presence of protein and its excretion rate. What are the treatments for eclampsia? Delivering your baby is the only way to cure preeclampsia and eclampsia. If your doctor diagnoses you with preeclampsia, they may monitor your condition and treat you with medication to prevent it from turning into eclampsia. Medications and monitoring will help keep your blood pressure within a safer range until the baby is mature enough to deliver. If you do develop eclampsia, your doctor may deliver your baby early, depending on how far along you are in your pregnancy. Early delivery may occur between 32 and 36 weeks of pregnancy if you have life-threatening symptoms or if medication doesn't work. You may need to hospitalize until you can deliver your baby. Medications. Medications to prevent seizures called anticonvulsant drugs may be necessary. You may need medication to lower blood pressure if you have high blood pressure. You may also be placed on a low-dose aspirin. Home care. Pay attention to your diet. Ensure you get enough calcium. You may have to go in for fetal monitoring and checkups more often. This monitoring may be done from your own home if those services are offered in your area. Taking all prescribed medicines, getting rest, and monitoring any changes in your condition are critical for managing preeclampsia and eclampsia. With proper care and careful monitoring, you can deliver without complications. What is the long-term outlook for eclampsia? Your symptoms should disappear once you have your baby. That said, you will still have a greater chance of blood pressure issues in your next pregnancy. If complications occur, you may have a medical emergency such as placental abruption. Placental abruption is a condition that causes the placenta to detach from the uterus. This requires immediate emergency cesarean delivery to save the baby. The baby may be very ill or may even die. However, getting the proper medical care for preeclampsia may prevent eclampsia. Go to your prenatal visits as recommended by your doctor to have your blood pressure, blood and urine monitored. Make sure to talk to your doctor about any symptoms you have as well.